Good afternoon, everyone. Thank you for joining us for this afternoon's very exciting webinar. My name is Sam Peck. I am the Executive Director of Family Councils of Ontario, and I am very pleased that everyone is joining us. So, to get things started, today's session is CareTO, Investing in Our Seniors Through Emotion-Centered Approaches to Care, co-hosted by Family Councils of Ontario and CARP Ottawa. To get things going, we're going to do a land acknowledgement. FCO is a virtual organization and we work across the province. So our work and the work of long-term care homes, family councils, family caregivers, takes place on traditional Indigenous territories across the province we now call Ontario. And our team is thankful to be able to work and live on this land. First Nations peoples were the original inhabitants of the land that's now called Canada. And in Ontario alone, there are 46 treaties and other agreements. I'm coming to you today from Hamilton. And the city of Hamilton is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. It's land that's covered by the Dish with One Spoon Wampum Belt Covenant. And that was an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. Since then, other settlers and Indigenous communities have been invited to share in the covenant and commit to protecting the resources. The land I'm on is also land that's covered by Between the Lakes Purchase of 1792. That was between the Crown and the Mississaugas of the Credit First Nation. And we're appreciative of the First Nations, Métis and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of long-term care homes and communities across the province. If you don't know, acknowledging the land is an Indigenous protocol used to express gratitude to those who reside here and to honor the Indigenous people who have lived and worked on this land historically and presently. It allows us, whether we are descendants of settlers, people who arrived here against their will, perhaps through the Atlantic slave trade, or Indigenous themselves, to appreciate the unique role and relationship that each of us has with the land. And it can provide a gentle reminder of the broader perspectives that can expand our understanding to encompass the long-standing rich history of the land and our privileged role in residing here. There's a great website called native-land.ca. And if you type in your address, you can learn more about the people, territories, and the languages of the land on which you live, work, and care. We've committed to reconciliation as an organization, and we're taking steps to establish true and meaningful relationships with Indigenous peoples across the province. And we invite you to continue on this journey with us. Couple logistics and housekeeping before I turn it over to the guest speakers. All of you as participants are in listen-only mode. We have protected time at the end of the session for some Q&A. At that time, we invite you to use the Q&A box to pose your questions to today's guest speaker. Please use the chat feature only if you're having technical issues, or you can reply to the email that was sent to you with the link for today's session. The session's being recorded and will be made available to participants following our time together, and that'll be on our YouTube channel. So now it is my pleasure to turn it over to today's co-host, Kathy Wright of CARP Ottawa. Kathy, over to you.
Thank you very much, Sam, and thank you to all for joining us this afternoon. We're once again very pleased to be co-hosting this webinar with Family Councils Ontario. At CARP Ottawa, we see ourselves as champions for change in long-term care from institutions to home. This kind of change means creating a warm, caring environment that feels like home, where staff truly know their residents and families, and understand their lived experience, where meaningful activities engage residents according to their abilities and what brings them joy, where relationships thrive between and amongst residents, staff, and families. And this kind of change can be done and has been done and continues to be done in Ontario right now and in other parts of Canada, in both old and new buildings, and also in for-profit, not-for-profit, and municipal homes. And you'll be hearing about some of this from Josh today. So for the last 3 years, we've been working with other CARP chapters and like-minded organizations in Ontario to create a conversation about all the positive opportunities that exist in long-term care homes today. We're concerned that long-term care homes could easily fall off everyone's radar, and we can't let this happen after 40 years of endorsing all these all these homes that have had all these tragedies and the experiences we had during COVID. So we invite you all to help us spread this conversation by sharing the information you will hear today with your friends and contacts. You can also help by sharing our website, www.changeltcnow.ca, where you can find recordings of all our monthly Lunch and Learn webinars for the past year or so, as well as blog posts and numerous other resources. So I now have the pleasure of introducing Josh Matlow. Josh has served on Toronto City Council since 2010, and he has received way too many accolades to mention them all. But just to name a few, he's been recognized as a Toronto Star Newsmaker of the Year, a person to watch, Toronto's best public official, and Now Magazine's top activist of the year. Congratulations, Josh. I'm sure that's only a few of them. Josh has been leading the charge to create the CareTO model of care for Toronto's municipal homes, and is now, as most of you probably know, is running for Mayor of Toronto. Thank you so very much, Josh, for making the time to be with us today in your hectic schedule. And now I'll hand the mic over to you.
Well, thank you very much. And thank you, Family Councils Ontario and CARP, for inviting me. And yes, I have a hectic schedule running for mayor, as you can imagine, but improving the quality of life of residents, and in particular in this context, seniors, whether they live in our communities or in congregate care settings, is one of the reasons that I want to be able to provide leadership, because I believe that these are not only important priorities to us all, but as our city, like most cities, continue to age in our demographics, it is going to become more and more important to design our cities, no matter where we live, as age-friendly cities to ensure that we're all healthy and well and safe and have a good quality of life till our very last days. And that's certainly what I'm determined to do, and I know that all of you share those goals. Now, I was elected to City Council in 2010, and one of the first initiatives that I brought forward to Council was to create a senior strategy for the City of Toronto. I was inspired by my parents when I was 13, who, under duress, told me that I wasn't going to be just hanging out all summer, but I was going to go and volunteer at Baycrest. And I went, and they wanted to teach me a lesson about how important volunteerism was. And my experience at that age taught me that volunteerism wasn't simply altruistic, but that you learn so much, and you also find a sense of purpose and value in the time you spend helping other people. And I learned a lot about the challenges that many of the residents had as they aged at Baycrest, but also I started thinking, even as a kid, about ways that we could improve upon the kind of care that they received, because I was learning lessons from them, from people who had had a few years on me. And then as my family continued to age, and my mom passed away, and even more recently, my father has been suffering with Alzheimer's the last several years, I recognized that it was, so deeply important to ensure that every individual in our city is able to live well and healthfully with the care that's needed to support their quality of life. And as Mark said quite well, this was all highlighted during the pandemic when many of Ontario's long-term care homes became the focus of the pandemic, certainly in the early days, because of tragedies. Because the approach to warehousing those who we love, often in very unsafe and under-resourced environments, led to unsafe environments that I think all of us rallied around a common cause to improve upon. But as the pandemic has continued to wane, I think that attention has been lost and that focus has been lost. The way that we described PSWs as heroes during the pandemic has been forgotten by our government in many ways, including our nurses, when I believe that they should be paid and supported as the heroes that we describe them as. So when I became a city councillor and I had the opportunity to move forward with initiatives that I had only dreamt about seeing happen, the senior strategy really initially focused on priorities that we heard from the community, such as housing, access to affordable housing, transit, and services. As part of the 2.0 strategy, I also came forward with motions to City Council to improve upon the quality of care in the city's 10 long-term care homes. And by improving upon the quality of care, really the focus was on lessons that I had learned from approaches like Butterfly and Greenhouse and other approaches that take an emotion-centered approach, where everything from the amount of time that the staff in those homes have to focus on the individual needs of the residents, along with even the environment, turning it into a caring and loving and respectful environment rather than an institution, means so much, often in particular to those with dementia, but frankly for all those who live and work in those congregate care settings. And as we invested in that program, my motions were successful. As we invested in that program, we began a pilot at Lakeshore Lodge, which we also have approval to eventually expand to homes across our city. A difference between Butterfly and Greenhouse is that it is more of a uniform approach, each one of them, and that we're taking a more contextual approach to the different homes, recognizing that we have a very diverse city with unique and distinguishing characters that come from cultures and languages and specific needs that we want to see reflected in the kind of care and environments we create. But I'm very proud that we are moving in this direction. We called it CareTO, to be candid, because everything we do has to have a TO at the end. But it's also a brand that demonstrates that it's about care. And it's informed by research, like the other approaches that I described, like Butterfly and Greenhouse. It's evaluated, it implements science, and it brings evidence into action. We also want to make sure that we recognize that there's different levels of dementia and cognitive impairment, and that we're diverse and agile enough to meet individuals' needs. We'll know that the model is working based on feedback from residents and family councils. We want to see an improvement in staff retention and satisfaction levels. We want to give staff the ability to have the means and the living wages to be able to work in the same place. We knew that that was a real problem in the early days of the pandemic, when staff had to, just because this is an unaffordable city, work many jobs in many places, which also wasn't safe because of the concern about transmission of the virus. Looking at residents' nonverbal cues. We want to see if there's a reduction in residents' responsive behaviors. We want to see less of a reliance on pharmaceuticals, and changes in indicators over time in our long-term care homes that demonstrate to us that what we're doing is a success. We also, along with a focus on improving our long-term care in general, when I talked about our diverse needs, for far too long, residents from the 2S LGBTQI plus community were not met with the sensitivity that many of those individuals need. Individuals who have been subject to homophobia, to persecution, sometimes legal persecution in earlier years. And we recognized that our staff needed to have a toolkit to have as a vital asset to understand how to be supportive and respectful and inclusive, to affirm the kind of care that these seniors deserve and expect. So that's something that we were very proud to roll out, and we announced at Castleview Witchwood Towers. And it's something that we hope to see all of our staff review and be knowledgeable about and be well trained in throughout the entire system. And I'll lastly mention that while I'm determined to ensure that every one of our long-term care homes in Toronto are emotion-focused, are caring, are loving, are respectful, are supportive environments that don't warehouse our loved ones like too many other places, but provide environments that any one of us would want to see somebody we love be in, maybe ourselves one day, that it's not the choice of everyone. And that's why I'm also actively supporting efforts like UHN Open Lab and others to support NORCs, naturally occurring retirement communities in our neighborhoods, so that for those who do want to age in place and live in their communities and have the familiarity and support of the people they know on their main streets and in their neighborhoods, that we continue to plan our communities in a better way to ensure that resources and supports are there to assist individuals who want to be in their homes. By doing that, it not only empowers and supports those people, but it also takes the pressure off the capacity in congregate care settings where those who want to go can go, and those who need to go because they just need that measure of assistance can readily go, and hopefully at price points that are more accessible to more people than many are today. I want to thank again all of you for inviting me. I know that we share this purpose. I'm really proud to be part of you and part of a movement toward a more caring and loving society that understands that growing old doesn't mean that we forget people, but that we include them and that we celebrate the knowledge and the expertise and the experience that older adults bring to our society. Thank you.
Thank you very much, Josh. Actually, you're very inspiring to me just to listen to you. You've touched on a number of things that really are quite heartwarming. You've taken your personal experience with your family. You've taken Baycrest, so you know what's happening. You've seen family members go through this. And what you're trying to do now is alter the way that quality of care is provided. And that's exactly what we're all about here. And what's interesting to me is when I listen to you is how you managed to pull it off. So you pulled it off in Toronto in 10 municipal long-term care homes. You somehow were able to challenge the council to move forward on this. And do you want to speak just for a few minutes how you managed that?
Thank you for your very kind feedback. I really appreciate that. Listen, I know, especially when you're running for mayor, you're supposed to boast about how you did pull everything off and you've been really successful and should get a lot of credit. So I'm going to fail in that regard for a moment because I just want to acknowledge that there were some things that we've been successful on, but it's still a work in progress. This is still being piloted. There's still more work that we need to do in many of our long-term care homes to really bring them up to the standards that I would like to see them arrive at, as I know you would. But the way that I was able to, I think, honestly, describe this as moving the momentum toward an emotion-centered focus was, first of all, to get the Toronto Senior Strategy approved a decade ago. And that was during the time, you may have read that we had a mayor named Rob Ford. And that was an interesting time, to say it generously. It was a very polarized council. It was a very controversial time. And there were very strong ideological contests going on about our approaches and the way that we would fund things. And the way that that the staff, which later became our senior services division, and I worked together, was that we were really mindful that there was no way that Rob Ford was going to fund anything new that we brought to the table, even if it was a good idea. He was about chopping everything rather than funding. So we did it in a way that could be a little more evergreen. The first tier of what we brought forward, very intentionally, were the mission statements, the goals, and the kind of things that we could do as a city that didn't cost any money, but that we could work within our existing means to be able to see through to fruition. Along with then showing what needed to be funded and what we needed to advocate toward other levels of government to get the necessary allowances and approvals to be able to do. But we did it in a way very intentionally so that that maybe dollars spent might be controversial, but the need to improve the lives of older adults would be inarguable. And I was able to earn unanimous support at council. Left, right, and center, we got all the votes and we got it done. And by doing it that way, once we were able to let every councillor put in their newsletter about what a hero they are for seniors, then we went back to them and said, oh, by the way, now that you've boasted about how awesome you are and supportive you are, now you're going to have to deliver. And this is how. And then we started putting budget requests forward and we're able to build that support. So I'm really proud of the way that we did it. And I must say, none of that had to do with me. I mean, I argued for those improvements, but the staff who I worked with were really part of that process, working with me, and it was successful. Similarly, with the emotion-centered focus for long-term care, even though some people may have noticed that our former Mayor John Tory and I didn't always agree on everything, we were able to find very clear agreement on the need to improve long-term care. And once I was able to achieve his agreement and support, and then I went out there and I said, I want these motions passed. And he went out there and said, I agree, we've got to get this done. Then there was no question that council would support us. So it was really about building consensus, and ultimately, regardless of partisanship or ideology, or if you're left or right or this or that, we just put the right ideas forward and the good ideas forward, and then the support followed. And really, that's how we've made the success that we've achieved the success that we have done. But I just want to reiterate, we are nowhere near where I want us to be. And I'll put a plug now and say that's why I'm running for mayor, because the idea of actually being a leadership position where I can not knock at the door and wait for somebody to do something, but actually be able to realize it excites me.
Well, that's very interesting, and quite a process that you went through, and it's something that other communities perhaps can follow. You've laid it out quite clearly.
Yeah.
So the pilot that you're starting is at Lake Shore Lodge, I believe. Yes. And what exactly is the pilot? What exactly have you changed that was not there before? Let's look at what it looks like now as to what it looks like before, and then maybe find out from you what the feedback has been from others who are in Lakeshore Lodge to see how they feel the change has happened, and are they happy with it, and so on.
Well, there have been some improvements to the physical environment, everything from the colors on the walls to just, how they deliver the services in a way that meets individuals' needs. It creates an environment that is more kind of respectful and caring and isn't rushed. And when I say rushed, that we've also invested in expanding the amount of time that each member of the team, including the PSWs, are able to put toward each individual. So they're able to actually understand what their needs are as a person and how to care about them and with them rather than at them, because they're just having to snap, go to deal with somebody. They're actually working with that person and respect their agency. So the number of hours, if my memory serves me correctly, went from 2.75 to 3.25 hours due to the investments into those individuals. And so far, the feedback has been very positive, both from the family councils and the residents and the staff alike. The thing with Lakeshore is that, there hasn't been, because it's a pilot, there hasn't been an enormous amount of physical retrofitting or redesign, like taking away sort of the nurse's station, for example, as many emotion-centered homes do yet. But what compensated for the lack of that kind of work, just because you don't do that at the pilot stage, that's a heck of a lot of money to put into something before you've decided what's working. It was the people. So investing into the individuals, into the amount of care that they could provide. When I visited Lakeshore Lodge, there was this energy in the staff that was electric. Like they were giddy, they were happy to be at work. They were having fun even. They were enjoying each other. They were enjoying the residents. The residents were happy to be supported by them. And there was an environment, to say it simply, that just, it wasn't even as much about the paint on the walls and all of that. It was about the people. And I just learned that if you invest in the people, no matter what more you do, and if they have the time and the ability to spend time with individual residents, it means everything. And I think so far that has been the best feedback that I've received. What I'd like to see done, throughout the existing homes throughout the city, I alluded to this earlier, is really focus more on the cultural and the unique demographics that we have in those communities. Because when one, as you know, have cognitive impairments, when you have dementia, things that are familiar, things that are supportive to you mean so much. And that can come from understanding who you are and where you're from and what you value, and then seeing that identified in the environment that you're in. So I'd really like to see those environments really tailored to, bespoke to the very people who we're serving. And that's something that we're exploring as well.
Do you kind of see a special unit then to a cultural group, so that they're together and staff are working together within this culture? Is that how you kind of envision that? Or?
I see, like there are some of emotion centered long-term care homes that, for example, will ask an individual resident, what did your front door look like when you either raised your family in a home or you grew up wherever you were, and then they'll actually put they'll put a screen on the door to make it sort of familiar to you, so you feel like you're at home. So that can come in different shapes and sizes and different designs, whether it be creating an environment that might reference the land that you're from, or the community that you feel a part of, or something, just something that you love, whatever it might be. It's not like a unique department so much as that our senior services division, as we roll out the emotion-centered approach to the many long-term care homes, will recognize the demographics that we're serving. So for example, if there's a large, I'm picking one arbitrarily, but a large Chinese community or a large Somali community that we find at that home, we should be acknowledging that reality and taking steps to make the place feel like home and familiar and distinguishable for that community, while recognizing that we can't ignore the fact that there will be a diversity even within that home that needs to be met as well.
Well, that's good, because you're focusing now on the individual, the needs of the person, which is perfect. In order to increase the staff time per resident, then, did you hire more staff, or how did that work so that you could give more hours to each resident? Yeah,
we hired more staff. We made sure that not only are we going to have more staff, but more resources available to them to be able to not rush, to spend the time that's necessary to be able to meet the needs of those individuals. My father, and it's kind of funny how life sometimes comes full circle. My mom and my dad were the ones who got me to volunteer at Baycrest when I was 13 years old. Now, my dad is a resident at Baycrest at the Terrace. I just visited him again yesterday, and I thought about that, and as difficult as it is, and I think any of you who are caregivers understand this, as difficult as it is to see a loved one go through what they're going through, it can be hell. It can just be awful. Sometimes I don't know what's better, when he is aware enough to be more of himself, but then sadly aware of what he's going through, or when he's not aware of anything altogether, but then he's more passive about the pain that he's going through. It's hard. Yeah. But I also recognize how lucky we are to have him at one of Canada's greatest places that he could go to meet his needs. But boy, does it cost a lot of money. My dad earned a good living, and he put away savings. That's the reason that he's able to be at the Terrace at Baycrest. But that doesn't describe most Torontonians or most people in Ontario. And I just believe that everyone should have the ability to either go themselves or be able to have somebody they love go to a place that has the kind of resources and attention to those individual needs. And today, that doesn't describe a lot of homes in our province. So, do you see the budget that you were able to get through council? Do you sort of see this carrying on? Like, I'm not sure how long the project is at Lakeshore. So how long? Lakeshore is a pilot, and right. And council has committed to make more investments into CareTO in our last budgets. But we're going to have to. Not to make any announcements today, but I can tell you as mayor, I will have to move more funds toward expanding the pilot, not because we want to spend more money, but because if we're serious about investing in what we've committed to, which is an emotion-centered focus for our long-term care homes, then we're going to have to invest in those priorities. That's why I also announced, I may be the only mayoral campaign that's ever announced a tax increase at my announcement. Some people might say that was a wild thing to do. But the reason I did that is that I just believe that we should be honest and upfront. Our city is facing a major financial challenge. There's a massive budget shortfall that we have. And if we're going to expand Lakeshore Lodge, if we're going to expand CareTO into all 10 homes, then we're going to have to make investments. And at a time when our city is broke and the cupboards are bare and the reserves are all gone, we're going to have to be honest about how to pay for that. So I can tell you quite upfront that we're going to have to look at using property tax dollars to improve those services.
Well, I wish I lived in Toronto, because it's very pleasing to me to hear that you put more money to improving quality of life in long-term care homes.
May I add though, that, well, we're going to have to, like, I just hear so many people always sort of like, we're going to do all these things, make all these announcements, but have no way to pay for them realistically. I do believe that we need to renegotiate with the province both a governance and financial framework, because whether it be social housing, transit, or long-term care, I do believe the province needs to invest more into long-term care, both the city-run ones, but across the province, and put a focus on public long-term care as part of our health services, rather than continuing the trend that the province has been on to see them become more and more private, where the profit motivation distracts and often gets in the way, as we saw during the pandemic, toward altruistic care that we need to provide to older adults. The province needs to get back into the business of seeing that long-term care is actually part of our public healthcare system. And that's something that I will continue calling for.
So there's a couple of questions coming through here, so we'll go right to those questions. Exactly how long do you think the pilot at Lakeshore will carry on? And then when do you anticipate the rest of the municipal long-term care homes will begin?
So I think the outlook for the pilot is to 2025. It doesn't mean that we can't begin to expand the pilot during the next 2 or 3 years, but this pilot itself, that's what it's focusing on. Sorry, what was the last part of your question?
Well, when do you anticipate that this will roll out, this approach to the other municipal long-term care homes?
Yeah, so under the last administration, I think it was supposed to roll out, post 2025. Again, we're going to do a whole bunch of announcements over the next few weeks, so I don't want to myself here, but I would like to see us expedite that timeline, because I'd like to see people who are going through some of the same things as my dad is going through today have more access to more affordable long-term care sooner than later. So, right now we have, I think there was an increase in the last budget by something like $29 million. That was an increase in roughly 230 positions. And I'd like to see that even further expanded so that we can get going on improving care in the other homes that we have across the city.
Okay, and you mentioned about you have increased staff, and you're trying to cover this off with the budget and so on. Have you had trouble finding staff? There's been a staffing shortage, and people haven't been applying to long-term care. Has that been an issue that you've faced at all, or?
Not that I'm aware of, although
okay.
To be very, very upfront with you, I don't know authoritatively the answer to that. And that's a question that I'd want to ask our professionals in senior services, but they certainly have not brought that concern to my attention.
A lot of homes, I think, are using agency staff to kind of fill in behind. So I'm not sure if that's what's happening with CareTO, but that certainly would be something.
Certainly during the pandemic, I know that was a big problem, including just more and more people either unwell and being at home, or concerned about coming into work. I think that has dissipated to an extent. That's what I understand. But remember, we're, unlike many homes across Ontario, we're paying people relatively well. We're providing them with the hours that they need to do their jobs well. We're trying to. What I want to see is we set a standard, a model, where we pay our workers well. We ensure that they've got the kind of benefits that they need to be able to afford to live in an unaffordable city, that they can remain at one job at one time rather than having to, do a night shift somewhere if they're working the day. And ultimately, even like an increase of direct nursing hours from 3.66 to 4 hours of care per day by March 2025. That's the goal. that will actually, demonstrate to nurses that this is a place you want to work in. This is a place that they're struggling right now with the Ford government to get fair wages. The City of Toronto is saying, come work here. We're gonna treat you like the heroes we told you you were.
Yeah, well, that's good. And I appreciated your opening remarks where you said the PSWs, were heroes during COVID, and they need to be recognized and paid for the value, for sure. I guess another sort of question I'm thinking about is when we talk about emotion-based care, it's hard sometimes, I think, for staff to kind of turn their heads into that. Not that they're not caring people. I believe anyone who works there are caring and supportive, but they're living in a system that's very task-based.
Yeah.
So how do you take an emotion-based kind of approach into a task-based environment? Do you have education for the staff? Does it just happen automatically? Like, how does this come about?
Yeah, it's a combination of everything you just described. I mean, there's, rather than a medical model, there's a renewed focus on training to ensure staff have the skills to provide a responsive, emotion-centered approach to care, one that has training to respond to unique cultural needs and sensitivities that really understands the kind of activities that they'd want to participate in, for example, or the kind of foods. Sorry, somebody's getting the door. Or the kind of foods that they prefer. So, the kind of training that staff not only need to be able to better serve residents, but frankly, that they would want, so they can our staff are professionals. They want to do great jobs. But if they don't have the training and the understanding to support the individual needs, then they can't do the jobs that they want to do. But also, upping hours from 2.75 to 3.25 per day for PSWs to 4 hours for nurses, to be able to ensure that they aren't rushed, that they can take a deep breath, that they can really sit down and listen and understand and learn from those individuals, ultimately support that staff member and support that individual because they get the care that they need. And I mean, just to put it into just an individualized form for, when we talk about our staff, how many times have all of us gone into, whether it be long-term care or a hospital, ER, or wherever, these institutional environments where everybody is stressed and overtired and anxious. And when you're in that mode, even if you are a caring professional person, you cannot deliver the service that you want to deliver. But if you can focus on one job, you get fair wages, good benefits, you have the time in the day to do your job well, not only can you deliver better, but you're happier as well. In other words, if we care for the people delivering care, then we care about their well-being, their physical and mental health. We can retain them. They take less time off work because they're well and they're able to deliver, and then everybody wins. And that's the kind of work environment that I want to see. And frankly, this isn't altruistic. It's actually a better service delivery model.
Is there a specific training module then that staff go through for this pilot?
That is being developed. So yes, there is training, admittedly often borrowed from emotion-centered approaches that we are learning from, but that's part of the pilot as well. What's working, what's not? We're asking everyone from the staff to the family councils and residents to let us know how things are going. Is it working for you? Did we meet your needs? Are we giving you food that you didn't like? And if, as we move forward, if we see a better work environment, a better environment of care, less reliance on on pharmaceuticals, if we see just people who work in our long-term care homes and people who live in our long-term care homes providing us feedback that their cultural sensitivities were understood and served well, if people are happier and healthier, then we know we're doing our jobs. And you know what I've learned is that when you ask people how they're doing and if we're serving them well, they will not hold back. And I love that. In fact, that's why even when we created our senior strategy, we took a very different approach to government. We didn't, as I sort of joked earlier, we didn't just boast about it and say, look what we did. We created an accountability table. And we invited, some of you here might be on that table. And Dr. Samir Sinha, my friend from gerontology at Mount Sinai, and I co-chaired that table for many years. And the point of the table, while we're implementing our senior strategy and our emotion-centered approach to LTC and other initiatives, was yes, to tell y'all what we're doing, but also asking between 60 and 90 members from every sector of society who care about older adults, what do you think? Do you like it? Did we mess up? Do you think we can do better? Do you either want to give us a pat on the back, hopefully, or do you want to say that we totally missed the mark and we have no idea what we're doing? We welcome that, because the more that government's feet are held to the fire, respectfully and constructively, the more that we can improve. And so that's the approach that we're going to take to this pilot.
So it's great that you have the qualitative assessments in place and you're checking with everybody, all people involved, and getting their responses. Do you actually have an evaluation tool that measures more of the specifics?
Yes, and I'm not the expert in the evaluation tool, but what I have been assured by the staff who are doing it is that similarly to greenhouse and butterfly, where they have a full audit with specific benchmarks and requirements to measure whether or not they're being successful, so do we. And it's constantly going to be, evolving and developing based on, as I alluded to earlier, the unique needs of the kind of demographics that we're serving. But certainly throughout the pilot, there's going to be an evaluation that will have those specifics. And then as part of council's determination about whether or not it will continue funding and supporting the expansion of the pilot, as I sort of winked to you earlier, if I'm mayor, we may not have to wait till 2025. Then we'll have not just hey, this is a great approach, why don't we move on it? But we'll have real data and real evidence to be able to base that decision on.
That's good. Previously, like in your opening remarks, you talked about the importance of research and building on things, and you talked about butterfly and greenhouse, and those are great models. They're two of the innovative models that we promote and adhere to. The issue is, I think for me, is that there are some very good long-term care homes here in Ontario, and you mentioned Baycrest, and certainly it is an excellent one. There are others as well. But what's happening in the government is sometimes the residents, the people can't get to where they'd like to go. We've had a bill come out where that was the case, where people who are in hospital have to go to the first available bed. So this becomes an issue when we try to promote specific homes or models of homes and try to get people in, and then of course they can't. Do you have any comments about that bill that came out? I'm trying to remember what number it was.
So easily. First of all, I think, and by the way, I forgot to mention it, it's the Wellesley Institute that is supporting the evaluation tools that are evaluating the pilot. So we are working with partners to make sure that it is objective and independent, rather than our own city staff saying that they've done a good job, which I think is really important to have that arm's length approach. But yes, I mean, you just said that it's difficult for a lot of people to be able to access a home in the first place and be able to get to where they want to go. But I also think it's just shameful and wrong for the Ontario government not only to make it not more possible to get to where you want to go, but to be forced to go where you didn't want to go in the first place. I have to go about 20 minutes to go visit my dad. Imagine if he was sent to Thunder Bay or Sault Ste. Marie. I mean, how awful, terrible. How awful, how inhumane to take that approach, just because we won't invest ensuring that we have the capacity in our communities to be able to take care of our loved ones and be near our loved ones. And anyone who knows what it's like to, have somebody with, in your life with dementia knows that they need that familiarity. They cannot be isolated because that's not good for them either, along with the rest of us who care about them. So so this is where I think health and long-term care meets planning. I would like to see the Municipal Affairs Ministry, along with our city, work on plans together to ensure that we have the ability, which we don't have today under the Planning Act or the City of Toronto Act, to be able to, along with ensuring that as our city grows and we provide more housing to people who want to live in this city, that as part of those developments, that we have the means to be able to ensure that services are there in our neighborhoods to support naturally occurring retirement communities, to support individuals who want to age in place. While we do that, we need to ensure that while, for example, like at Cedarvale on Walmer Road, that's a long-term care home that is closing in the community that I serve. It's going to be redeveloped as a residential building. That while, yeah, that always could have been a better quality of care home. I can attest to that. My grandma was there. The spaces are being removed. In other words, license is gone. It's not going to be a long-term care home. It's going to be a condo. And then those families are going to have to find somewhere else away from that neighborhood to be able to visit their loved ones. There should be the ability, while we redevelop, while we plan, while we grow, to ensure that every neighborhood, while we support aging in place, also has reasonable access within reasonable proximity to long-term care and other congregate care settings, so that even if you don't age in place, you can still age in your community. And as you have the ability, if you have the mobility to walk around your neighborhood, you still see the same shopkeepers and the same neighbors, and you live near the people you love. And at the very least, you're in a bed nearby people who care about you and who can get there within a reasonable period of time.
So I have just a couple more questions just as time wears down. Just to be clear, the pilot is being run at Lakeshore. Is it the whole facility or just one unit?
It's the facility.
The whole thing. That's what I thought.
And in partnership with the Family Council as well.
Right. And we talked quite a bit about education. And so is there any professional development in place for staff so that as they move along, they could maybe take some courses or whatever to help them in their new environment? Do you have any plan in place for that?
Yes. So as I mentioned earlier, there is training that staff are provided to understand what emotion focused care is. Understanding everything from cultural needs to if one is part of the LGBTQ 2SI plus community, to other specific sensitivities that need to be understood to be able to meet those individuals' needs. But it's not going to be static. It's in fact, the whole point of the pilot is that those training modules, often borrowed from best practices, from other emotion-centered focused approaches, are going to continue to develop through the pilots to ensure that we have I always, it's an overused term, but made in Toronto approach, so that we understand our local demographics, our local colloquial needs, so that we meet their needs directly. The toolkit that I announced earlier for for members of the LGBTQ2SI community was something that was fought for years by that community. The city dragged its feet. It never provided that. But working with leaders in that community, we were able to develop that toolkit so that now it's readily available for all staff, not just at Lakeshore Lodge, but across the system. So that's part of the success of the pilot will be the training as well.
So some very specific questions here as we wind down. The current standard staffing ratio, and I believe it's 1 to 8. I'm not sure, but that's what's written here, and that could be so. In order to increase time spent, what would be the ratio at Lakeshore? You said you've increased staffing, so I'm assuming it will be a different ratio.
Yeah. So the total budget for this year is $374 million, reflecting an increase of 27 million from the year before. Okay. So this goes into the Lakeshore Lodge pilot itself. We also have money from the ministry that's contributing to the program. So it's city money met by provincial money as well. The model envisions an increase of direct nursing hours from 3.66 in this year to 4 hours of care by March of 2025. And as I said earlier, there may be opportunities to expedite that. But that's also subject to the availability of provincial funding, because it's a partnership with the province. We're not going to be able to fund all of it, but we are hoping that the province steps up and meets those needs. And I know that the nurses and their unions are actively in negotiations with them now. We're going to further increase expenditures by, I believe, $29 million. We want 229 increased positions above and beyond the 2023 budget. And again, this is partially funded by the province, so it's not going to be completely the city doing it. But ultimately, if we're able to successfully invest the money that has been committed, I would add that we need to invest more money. We need to get the ministry to add more money. We're going to be able to see a much better and a much different long-term care system in Ontario or in Toronto than we've had up until this point. And then if we're successful, I hope that it's held up as a model throughout Ontario.
We're at the bewitching hour. There's lots of questions about families and how to encourage more visitations and so on that we did not get to it. But
can I say one point about that?
Yes, please.
I'm adamant that we need to make our long-term care homes safe. We need to screen. We need to do everything we can to prevent a tragedy from occurring in the first place. COVID was COVID, but COVID is not the only virus that can kill. But we cannot turn them into penitentiaries. We need to make sure that we always keep in mind that people cannot be isolated, and that needs to be done thoughtfully and just with an awareness that people need to relate to people they love, and that's something that I will continue to reinforce in the kind of service that you provide.
So my thanks for your very encouraging answers to questions, and I'm going to turn it over now to Sam. Thank you.
Thank you. Thanks for having me.
Councillor Matlow, please, on behalf of FCO and our attendees, accept our heartfelt thank you for the time that you have spent with us this afternoon. I know that models of care, emotion-focused models of care, are of great interest to families and councils across Ontario. And I'm actually also on the City of Toronto's Senior Services and Long-Term Care Advisory Committee. So I've been in tune with the work over the years, and I'm so excited to see it come to fruition. So thank you for your work on that, for your commitment to seniors and long-term care in Toronto, and for your time with us this afternoon.
Thank you. And to all of you in every municipality who are also trying to drive this change, any support that I can ever provide you, we have a movement together, and I really appreciate your advocacy. Thank you.
Thank you. We can make Councillor Matlow's email address available. Also, you can Google his website and find out more about CareTO as well. So thank you again to everyone who's joined us. Be safe, be well, and thank you for your commitment to long-term care.
Thanks, everybody.